So at what point after all those over-the-counter or
Right.
those conservative treatments are done, someone may need surgery?
So what we will see in arthritis, particularly knee arthritis, is that what happens is people's scope of experience or cone of living will start to narrow, right? So you used to do all this stuff. You used to go to the store, you used to do exercise, you used to go visit family and friends, go on vacations. But now you say, you know what, I don't really go out on Sundays anymore. And some people just say that as a declaration. But then you actually sit them down and say, well, why? And you say, well, it hurts. It hurts. It hurts me to walk. And if you look at, knee replacement surgery, it really is a quality of life intervention, okay? Because as your knees start to hurt with daily activities, I mean, let's face it, to walk, you need your knees every step, obviously. Right. That's obvious. And if they are painful, swollen, if they don't bend, if they're stiff, if it's painful to put your foot down and move, then you're not going to do things. You're going to start to eliminate things, right. And your life is going to suffer because of that. Pain. So what I tell patients is that if you have more painful days than not, if you've noticed that the ability, your ability to participate in the things that make you you and you happy, then it's a reasonable thing to consider.